Hello there, and welcome to another Wellness Wednesday. So this week I wanted to do something a little bit different. I have had a lot of patients that have had lab work with their doctor recently, and they have noticed that they've had some abnormals on their lab tests, but their doctor said everything looks normal and everything looks good and there's no problems. So I've had a lot of patients that were concerned of some of the numbers that were out of range, what it actually means, and if there's something they could be doing proactively to prevent issues later on. So what I want to do this week is I want to talk a little bit more about labs and why some of those numbers can be off. So first thing I want to cover is I've got 4 different lab tests that I think are probably the most common things that I see that can be off. And the first one is the CBC, or complete blood count. So if you've had lab work done, I would recommend pulling up a copy of that lab work so you can kind of follow along and talk a little bit more with me, or at least follow along with what might be going on. And if you feel like you need some more help when it comes to your labs, I do second opinions all the time. So you can actually email me your labs, and what I'll do is I will actually put together a lab report and actually sit down with you in a consultation to go over what the labs mean, as well as what could be going on in your body, and some recommendations for what you could be doing at home, as well as supplements that can help your body to heal and function better. So let's start with the CBC. So CBC is your complete blood count. That is going to go through your red blood cells, your white blood cell numbers, as well as the hemoglobin content, as well as the platelet numbers, and then the sizes of your red blood cells and the sizes of your platelets. And it's also going to go through the makeup of your white blood cells, what those all break down into. What's really great about CBC is if we see infection, we can see your white blood cell numbers are elevated. We can also see whether those are neutrophils or lymphocytes. So whether we have a bacteria or a virus issue going on that could be causing some issues with that infection. Hold on just a second here. Apparently my phone's going to go crazy now that we're in this video. So like I said, the CBC is kind of nice because when we see those infections, so white blood cells elevated, that can indicate infection or inflammation. So we can kind of break that down to see if it's a virus or possibly a bacterial infection, or sometimes even allergy symptoms can also cause white blood cell numbers to get elevated. So really neat to be able to see the breakdown of that, what that means. Now, when it comes to red blood cell numbers, a lot of times I find when patients are having issues with oxygen carrying capability, so say your hemoglobin or your iron levels are low, a lot of times what happens is over time, especially if you have a chronic issue, your body will actually increase the number of red blood cells you have in your body so that you're carrying more and more oxygen out to your cells. So if we see higher than normal or high levels of red blood cells, that can indicate we do have an anemic condition going on. And a lot of times we can also see your RDW, or your red cell distribution, with its outside of normal range, telling us that the cells are smaller or larger than normal. Usually when they're smaller, that indicates an iron deficiency where you don't have enough iron, which turns into hemoglobin. So oxygen carrying capabilities to outside of your cells. And when your cells are larger, that can indicate a B vitamin deficiency. So if you have numbers that are out of range on your CBC, a lot of times that can indicate we have an anemic condition going on. Now, a lot of times when it comes to anemia, there's many different causes or culprits that could be a factor. I already mentioned iron deficiency. When it comes to iron deficiency, we can either have a problem where we're not getting enough iron in our diet. So things that have iron in are things like spinach, any of your red meats or organ meats. We can also see beans have iron in them, as well as a number of other things. But typically, if you're not getting enough iron in your diet, that could be part of the problem, especially if you're not getting enough protein. The other thing too is if your stomach acid is not strong enough, because your stomach acid has a very low pH. It's meant to break down some of your protein cells and also break up fat so that it's easier for your body to absorb once they get further along the digestive tract. But as we age, we lose stomach acid. So that means that our stomach acid production is weaker as we age. So a lot of times, if we've already had digestive issues, or we're getting up there, and I'm not going to give a number specifically, but if we are seeing we're having digestive issues, that can be an indicator either that your body is not producing enough acid or strong enough acid to break down your food. A lot of times I'll see symptoms of people having heartburn or they're getting like more heartburn specifically with acidic foods, so tomato products, orange juices, spicy foods, that can indicate that your stomach is not have a good mucus coating or is not producing and breaking down your food properly. Another thing I see a lot of times is people that are noticing that when they lay down, they're having more issues with heartburn, or if they feel like they eat a meal and they stay full for a very long time. Normally, your stomach acid, if it is working properly, in about half an hour to 45 minutes, that food should be broken down and kicked out of the stomach into the intestine. So if you are feeling full for longer than 45 minutes, or noticing that after 45 minutes of digesting, if you sit down or lie down, it's coming up on you and you're starting to feel that heartburn, that could be an indicator that your stomach isn't working properly. So either not getting enough iron in your diet or not breaking it down and absorbing it in the stomach could be a big factor. Another thing that I see that can also be a factor too is if you are having irregular menstrual cycles, very heavy menstrual cycles, or frequent menstrual cycles, you could be losing a lot of red blood cells and a lot of iron through the menstrual cycle or through spotting and other things. And then you can actually have a deficiency where it doesn't matter how much you get, it's going out pretty quickly, and that can create anemic conditions. And those can be really scary because if you are having a lot of hormone balance issues, if you're having very heavy cycles or cycles that are coming very frequently, you may be literally like almost bleeding to death as a result of that. So if you do have hormone balance issues, I'm going to include, if you want to, we actually have a free hormone workshop on our website, so you can sign up for that, freedompeoria.org, or you can also comment below and I can PM or reach out to you and see if you'd like me to send you a link to that workshop as well. But that is a big one that I see a lot of times with women or women that have been struggling with fertility issues for a while, is that hormone cycle could be causing a lot of that iron kind of going on the way out. Another thing I see a lot of is gut dysbiosis. So basically, inside of your gut, you have bacteria levels that help to break down your food, that help to absorb nutrition, and they also make vitamins, minerals, and also natural antibiotic products to help your immune system stay strong. So if we have a bacteria imbalance in the gut or bacteria where it's not supposed to be in the gut, that can cause a lot of digestive issues and things can slow down, and that can also affect digestion and affect your absorption of some of those nutrients. So if you have, like I said, CBC numbers off, that can indicate that we could have some iron issues or B vitamin deficiency issues or possibly some bleeding issues going on, and that's definitely something you want to get checked out more. So if your numbers are showing abnormal and your doctor's not saying about it, I would highly recommend that you go to our website, freedompeoria.org, set up a consultation so I can go over those and give you some recommendations on how to approach that problem, as well as what you might need to look into and be proactive about before it becomes another health issue. The second lab test that I tend to see a lot of issues with is the CMP. So that's complete metabolic panel. That tells us what's going on with our liver function, with our kidney function, with our pancreatic function. It also tells us electrolyte balance. It tells us if we might be slightly dehydrated. It tells us if our kidneys are excreting waste. It tells us if the liver enzymes are elevated and there's any damage to the liver. So that CMP, if there's any abnormals on there, can indicate a lot of things. So typically, one of the most common things that I see is eGFR, which is glomerular filtration rate. So that's like your kidney flow rate, how fast fluid is moving through there and how well that's working. If your GFR is below 90, that means the kidney is struggling to flow and struggling to eliminate waste. That can indicate kidney damage. It can indicate dehydration. It can indicate electrolyte deficiencies, or simply kidneys just not getting what it needs to work. In some situations, we may need to look into herbs to help heal the kidney. In most situations, it means we probably need to look at how much water you're drinking and what types of salt, or if you're not getting salt, adding salt in to make sure your body has the electrolytes it needs to flow and get water balance throughout your cells working properly. Another thing too is if we have abnormals with our liver enzymes, so that's going to be AST, ALT, as well as aminotransferase, your liver is damaged, and actually the enzymes inside the liver are being leached out into the bloodstream. So when those are elevated, that indicates the liver is not working properly and is damaged. Now, sometimes that's because the liver is working extra hard. The liver is a filter that is responsible for filtering out foods, pesticides, excess hormones, medications that you're taking, supplements that you're taking. And sometimes if it's struggling, we can start to see where it just cannot keep up. So a lot of times when we have abnormals on that CMP and we see liver enzymes elevated, we normally want to do a liver healing and liver cleanse protocol to help support that and get it functioning and working again. So we're kind of cleaning out our filter. So if you think of like maybe an aquarium filter, the filter pads get really gunky. We have a turtle, so really gunky at our house. But basically we're trying to clean out those holes so it can flow and function and filter a lot better. In some cases too, along with that CMP, I will also see your lipid levels or cholesterol levels can also become out of range because your liver is basically a transport organ. So in addition to filtering everything out, it's going to actually help your cholesterol, your good and your bad cholesterol, to send some of those cholesterol precursors out to your cell and then recycle them back to the cell. So that's going to be your LDL, and your HDL brings it back to the liver for elimination. But those cholesterol cells are actually used to make enzymes and hormones in your body. So cholesterol is actually a good thing. That's what almost all of your sex hormones are made up in your body. So cholesterol levels are not bad. If they're off, that indicates your body's having a transportation issue or processing of those cholesterol cells and fat cells issue. So a lot of times when we're having liver dysfunction or liver damage, we'll see cholesterol levels go off with that. We can also see other fatty soluble vitamins, so things like vitamin A, vitamin E, and vitamin D, which is a very big one, can also be out of range. So if your vitamin D level is low, that could indicate your body is struggling with fat soluble vitamins. A lot of times we'll see cholesterol levels off. We may see some liver not functioning 100%, or sometimes even elevated liver enzymes. The third lab that I want to go over is TSH. So a lot of times I see many doctors doing a TSH, which is going to be your thyroid stimulating hormone. It's a pituitary hormone. So that tells us, is your pituitary gland sending a signal to the thyroid to function? Normally TSH values are anywhere from like 0.5 to 5, which is a very, very, very large range. The American I think it's Endocrinology Association actually has changed their recommendations for TSH values. Instead of being that large range, typically they recommend, I believe it's 1 to like 2.5 is what they consider ideal. So anytime I see somebody's TSH value below 1 or over 2.5, that tells me there might be an issue where thyroid isn't responding or working as well. Sometimes that can mean that we have an autoimmune condition going on in the thyroid gland, so Hashimoto's or Graves' disease, where the gland literally is inflamed, overworked, and not working properly. Sometimes we will see our free T3 and free T4 values off with that. Sometimes we can also see reverse T3 values through the roof. In many cases, when doctors do a TSH test, which is kind of a screening test, if that is outside of that 1 to 2.5 range, I usually say, okay, we need to look a little bit deeper and actually look at thyroid hormones and see what's going on. Is there actually a problem, or is pituitary just sending a lot of extra signals out? Because like I said, there could be an autoimmune condition going on. The thyroid gland may not have enough resources or the proper nutrition to make your thyroid hormones. We can also see sometimes even toxicity issues, because when we have toxicity in our body, whether that is from heavy metals, pesticides, or sometimes even mold exposure, or even hormone imbalances, your body will basically focus on detox and stop doing all the things that help with metabolism. So a lot of times we'll see an HPA axis, which is hypothalamus pituitary adrenal gland. All of those hormones can be off and not working properly if we're focusing on detoxification, if we're focusing on stress, if we're focusing on hormones. We can see where not all of those are working properly. So a lot of times thyroid issues can kind of be all over the board. We have to kind of figure out, is there a toxicity issue going on? Is there a stress issue going on? Is there an adrenal issue going on? A gut issue? What exactly going on that thyroid gland isn't working properly? If you haven't had a full thyroid panel done, usually I recommend getting TSH along with free T3, free T4, reverse T3, and then there's 2 different thyroid antibodies. There's thyroid peroxidase and thyroglobulin antibodies. I usually recommend getting all of those done, especially if your TSH is not in that 1 to 2.5 range, but also if you're having symptoms of thyroid dysfunction. I've done a video previously where I talked about thyroid dysfunction as well and some of the symptoms of that. I will try to post a link at the end to that video if you want to watch that a little bit more. And then the other thing that I always see lab abnormals that aren't really recognized or talked about is number 4 is going to be hormone panels. So when we are having hormone balance issues, especially women that have been having menstrual cycle issues, or women that have been having fertility issues, or even men that have had some issues with fertility or testosterone levels, everything from ED to prostate issues, a lot of times that can indicate that we can have a problem either with pituitary signaling down to our sex organs, or sometimes the sex organs are not working properly. A lot of times what I find is when we get hormone testing done, so estradiol, progesterone, testosterone, sometimes we'll even do cortisol and DHEA, we're only seeing a very tiny little blip in time. So if you get those labs done first thing in the morning, we're only seeing in the morning that, hey, everything's working, looks like it's a normal range, you're fine, everything's good, everything's normal, even though you know something's not right. A lot of times I find doing a salivary test where you're doing multiple samples throughout the day gives us a little bit more light as to what's going on. We can see what's going on with cortisol throughout the day to make sure that it's actually up in the morning, tapering off and going low throughout the day so it's not interfering with sleep or other body systems, because that can indicate that we need some extra support for the adrenal gland, or we might need to work on some dietary and lifestyle factors at that time of day. But a lot of times too, when we do salivary testing, we're seeing bioavailable hormones. So when you have estradiol, when you have progesterone, when you have testosterone hormones, there is another thing called sex hormone binding globulin. That's a binder. So basically binds to, so you cannot use those hormones. So unless the hormone is free and out there ready to do work, it doesn't matter what your levels are at if it's not free and out there doing work. When we do salivary testing, we only see bioavailable hormones. So I have patients that are on birth control or are on hormone replacement therapies where their body is getting synthetic hormones and their levels are in normal range on blood tests, but when we actually do our salivary testing, we see that the bioidentical bioavailable hormones are not in proper range. So estrogen's through the roof and basically causing toxicity, liver to work harder, causing a lot of estrogen dominance type symptoms, and progesterone's like bottom of the barrel. There's barely nothing there to counteract some of that. And progesterone is a lot of times related to HPA axis dysfunction. I see a lot of digestive issues where either we're not getting enough protein or we have poor stomach and acid function where we're not breaking it down and absorbing that properly. I've also seen a lot of issues with, like I said, the HPA axis disorder. So when you have an HPA axis disorder, your body is struggling to balance hypothalamus, pituitary, adrenal, and get all of those working properly. So that can affect everything from thyroid function to sex hormones. It can affect your mood. It can affect anxiety, depression. I've also seen panic attacks with that. We can see a lot of anger, irritability issues, and then we can also see adrenal issues going on. Now, adrenals, those are going to be your stress response hormones. So those are going to help you to get up and respond to stress. But when we're constantly under stress, your body doesn't digest, it doesn't heal well. We tend to get sick or notice that we're staying injured for a longer period of time. We can also see mood changes. We can see a lot of different systems affected. I've also seen a lot of metabolism changes where we're gaining weight even though nothing has changed. You can work out of the gym every day for hours and it's like you're not getting anywhere. It's almost like you're kind of wading in the same up to your chin in damage and stress and everything else going on in your life. So if you have any abnormals on your lab testing and your doctor is not going over those with you and going over recommendations for nutritional things you can do, as well as what your body's trying to tell you, it may be time to talk to somebody that actually knows how to give you some preventative measures. So things like changing your diet, making sure you're getting enough protein, sometimes even adding in a multivitamin or a digestive enzyme to help your body break things down faster. Or if you have a liver or kidney issue, what kind of supplements or what kind of things can we do to help support those organs so they can heal, regenerate, and start working at 100% again. So if you need help with that, please give my office a call. You can check out our website, freedompeoria.org. You can give us a call, 309-689-6200. And then I will also include some links to a couple different videos. I know I've done ones previously on stress and hormones. I know I've done some specifically for thyroid function. I will try to include a link to those at the end so you can follow along and watch those. And make sure you tune in next week. Every Wellness Wednesday, we go live at 5 on our YouTube channel. So make sure you check out those videos. You can find us on YouTube, Health and Lifestyle